How are you doing today?
Not so well. I mean, why else would I come to the A&E at midnight?
Yes, you do have a point. So, according to what you reported when you checked in, you are experiencing acute chest pain. Is this the first time you've had this type of pain?
No. I've experienced occasional stabbing chest pain over the last 2 years, but it usually goes away fairly quickly after a second or two.
And has that pain been in the right or left side of the chest?
It's usually on the left side of the chest, but sometimes the position changes.
Generally, cardiac pain lasting a second or two is not significant. So what about today's acute pain? When did it start?
It started about 4 hours ago at 8 p.m. and has been persistent since then. It is here, in the centre of my chest.
And what about other symptoms? Are you experiencing shortness of breath or heart palpitations?
Nothing like that. It does feel a bit better when I sit up and lean forward.
Okay, I see. Speaking of feeling better, did you take anything for the pain?
Yes, at 9 p.m, about 1 hour after the pain started. I took 2 paracetamol, but it didn't seem to make any difference.
So let's just talk a bit about family history. Do you have any history of cardiac disease in your family?
Yes, my dad had a myocardial infarction at 51 and also had a high cholesterol level.
Well, that certainly increases the risk of heart disease, but I see no other risk factors evident so far. Okay, so have you had any other illnesses recently?
Yeah, about 2 weeks ago, I had an upper respiratory tract infection that lasted for about 4 to 5 days.
What symptoms did you have at that time?
The normal ones, sore throat, blocked nose, sneezing, also a really bad cough. The whole house was sick with the same thing, my husband and 2 kids.
So I've taken a look at your electrocardiogram, and I think I have an idea of what is going on. You said that your pain gets better when you sit forward. This indicates a type of pain originating in the pericardium, the membrane that encloses the heart. Those 2 things combined with your recent upper respiratory tract infection points to pericarditis with a viral etiology.
Okay, so what is that exactly? Is something wrong with my heart?
So pericarditis is swelling and inflammation of the membrane surrounding the heart. In many cases of pericarditis, the cause is unknown, but one common cause is viral, which can be caused by a cold or pneumonia.
So is this serious? I mean, will I need to be admitted to the hospital?
No, I'm not recommending that you be admitted at this time. There is some risk for bleeding into the pericardial space, but for now, I'm going to recommend rest and NSAIDs.
How are you today?
I'm doing okay. Nice to meet you.
So they tell me you've just had an accident playing football. Do you know how long ago the accident happened?
Yes, just about 6 hours ago. I crashed into another player. They tell me I hit the right side of my head against his knee, but I don't remember any of it. He must have jumped pretty high for his knee to hit my head.
Yes. I can see here that you then fell to the ground and were unconscious for 20 to 30 seconds. So you continued to experience amnesia about the event?
Yes, I mean, I remember running towards the guy and then, nothing. Black. But then I woke up later and felt absolutely fine for a while. I mean, I was chatting with the nurse and trying to convince her to let me go home.
So after you arrived at the first facility, you had a generalised motor seizure and were given lorazepam to stop it. And I can see the CT scan done then was unremarkable. I can see now that you are having slight psychomotor slowing and some slurred speech. This may be because of the lorazepam. How are you feeling in general?
I'm a little nauseous. Also, I have a headache, but, I mean, that is probably to be expected, right? I mean, I hit my head.
Maybe. But I want to get another CT, a non-contrast CT of the cranium, and to keep you under observation as deterioration can be quite rapid in these cases.
In what cases? What do you mean deterioration can be rapid?
You described a lucent period before your seizure, which is a classical presentation of an epidural hematoma. Also, the fact that you then had a seizure and are showing a downward course with more neurologic problems is another sign that concerns me, and the symptoms you just described to me are also associated with this condition.
Okay, but what is an epidural hematoma?
An epidural hematoma refers to the accumulation of blood between the inner table of your skull and the outer dural membrane, which is the outermost layer of dense connective tissue surrounding your brain and spinal cord. This condition is generally caused by a traumatic event involving a blunt object, such as getting hit in the head by someone's knee while playing football. It often results in an overlying fracture of the skull. It is the blood vessels in close proximity to the fracture that are the source of the hemorrhage or bleeding. I do need to tell you that there are other possibilities.
What other possibilities? Are they worse?
Other possibilities are a subarachnoid hemorrhage and subdural hematoma. For these 2, a lucent period is not expected, but the CT will help us to determine what your condition is. For now, the most likely diagnosis is epidural hematoma.
Does it mean permanent damage? I mean, will I be able to play football again? I mean, my mum is already going to be pretty upset with me about this injury.
Generally not, because the underlying brain is usually minimally injured. Prognosis is excellent if we treat it aggressively. Also, you were brought in right away, which increases the chance of a good outcome. Of course, it also depends on what type of epidural hematoma you have. As for playing football again, we can talk about that later.
I really hope I can continue to play. I mean, I'm not that good, but I love the game.
Like I said, we can talk about that later, but first...